Okay, so I am refuting Ellie Hanneson's claim that allowing prisoners to become organ donors would alleviate the shortage of organs in the United States. Her first secondary claim states that, or says that organ shortage due to negative public perception of the medical field and donation, or organ donation, and we're info about this success. Prisoners have been denied access, or the second one is prisoners have been denied access to donate organs. Third is there is no actual law prohibiting prisoners from donating their organs. My claim is that allowing prisoners to become organ donors would do little to alleviate this shortage of organs in the United States. The speaker goes on about how public perception is a major driving force in why people do not donate their organs. It is true that this is a factor. However, the HRSA shows that 54% of all Americans are registered as donors. The problem is that only 3 out of 1,000 donors' organs are even usable after the donor has died. This brings up the main claim whether prisoners' organs are useful, since the New York Times says that they have much higher rates of infection from HIV and hepatitis than the general population. In the speaker's second secondary claim, they talk about how death row inmates are denied to donate their organs. It is true that they are denied to donate their organs. However, even if they could donate their organs, this would not bring a difference in the amount of the organ shortage per year, since only few are executed a year. The Death Penalty Information Center indicates that 20 were executed last year. Then the speaker goes on to talk about how 2 million prisoners in the U.S., if 1% of 2 million prisoners in the U.S. were to donate their organs, it would save 30,000 lives. But that isn't true. Through the Bureau of Justice Statistics shows that an average of 3,600 prisoners die each year from 2001 to 2014, and of those, only 70 or 87 die of illnesses, which gives a low chance to obtaining healthy organs from these prisoners. The third claim the speaker talks about is how Federal Bureau of Prisons decline prisoners to donate without any reason. There's the fact that the Federal Bureau of Prisons decline inmates to donate, since it would be hard to use them as donors. Arthur Chaplin, of PhD at the Division of Medical Ethics at NYU Medical Center, explains, "We would have to execute prisoners in hospital," which brings up an ethical question of if that's true, then one being that as the U.S. Department of Health and Human Services states that it clearly places the organ recovery team in the role of the executioner. Another reason why they might deny death row inmates this freedom is that the U.S. Department of Health and Human Services says potential jurors could be influenced to ultimately impose the death penalty more often with a potential societal benefit in mind, meaning they would most likely want to sentence more people to death the death penalty in order to possibly harvest more organs to help society. In all, prison donors are insignificant in helping the organ shortage.
All right, Scott, the opening is fine. You identify the claim and what the secondary issues are. You do have a general counterclaim that you're going to be using throughout the presentation, which is okay. You don't have to have a counterclaim at the beginning, but this is a continuing theme throughout most of your argument that it's going to do little to alleviate whatever shortages are available. On the first point, you've got a pretty good piece of information that talks about, how the public is already aware of organ donations, but the problem is really that the organs that they donate are only usable in a small number of cases. I would imagine, for instance, that would make it even more difficult for specialized populations. And then you've got a good follow-up with a nice piece of information from the New York Times that talks about how the prison population is more likely to have HIV and hepatitis. It would be also probably a good piece of information here to suggest that people suffering from those illnesses are not good candidates for donations. I think that probably is a safe assumption to make, but it would be clearer if you had some information that said that as well. There's not really any discussion of what the advocate's position on this is, and if the argument here is basically that we have a shortage of organs, then I think a counterclaim talking about other ways to increase organ donation or availability that don't require us to use prisoners would have been perfectly appropriate to talk about. On the second point, you have some information, again, trying to diminish the significance of the inmate population as a potential donor population. You mentioned that there are only 20 executions each year, for instance, so if we're talking about people who are donating as a result of dying in prison, being executed, that's a pretty small number. Later on, though, you had another number that said, it's someplace else, that there are like 3,600 people who die in prison each year, but a small number of them die from illnesses. That makes them bad donors. I'm not exactly sure why they are bad donors if that is the situation. That, I think, needs to be explained a little bit more. But again, 3,600 a year, that doesn't suggest anywhere close to, the amount of people that need organ donations that the advocate talked about on that first point. And then on the third point, I thought you had a good series of responses on this point. There's not really any discussion of what the advocate's arguments were, but you've got good counterclaims. I do think sometimes you need to make the claim. You kind of read the evidence and try to let it make the argument for you, and you should be making the claim yourself instead of trying to let the evidence make the argument. All right, thank you. Dana.
I need the outline for my
Okay.
measure.